Kineret anakinra is a recombinant human interleukin-1 receptor IL-1R antagonist that inhibits the pro-inflammatory molecules IL-1 alpha and beta from binding their receptor. Kineret is indicated for the treatment of moderately to severely active rheumatoid arthritis (RA) in patients 18 years of age or older who have failed one or more disease-modifying antirheumatic drugs, and the treatment of both neonatal-onset multisystem inflammatory disease (NOMID) and deficiency of interleukin-1 receptor antagonist (DIRA). Inflammation is a complex process mediated by an interdependent network of cytokines, such as the interleukins, that regulate the body's response to infection and injury. IL-1, a key cytokine of the innate immune system, triggers inflammation. Within the IL-1 family of cytokines, IL-1 alpha and IL-1 beta play a major role in the inflammation cascade. Production of IL-1 alpha further increases the production of IL-1 beta. IL-1 beta then contributes to the migration of neutrophils and lymphocytes from the circulation to areas of inflammation. In a healthy person, the endogenous IL-1 receptor antagonist IL-1RA binds the IL-1 receptor, displacing IL-1. In patients with RA, NOMID, or DIRA, the imbalance of circulating IL-1 can lead to a range of damaging systemic effects. Kineret acts by supplementing the naturally occurring endogenous IL-1RA. It competitively binds to the IL-1 receptor, which is expressed in a wide variety of tissues and organs. This competitive binding blocks the activity of the IL-1 alpha and beta cytokines that can trigger the IL-1 inflammatory cascade. Kineret is administered subcutaneously. In patients with RA, peak plasma concentrations occurred 3 to 7 hours after administration, at clinically relevant doses of 1 to 2 milligrams per kilogram. The half-life of Kineret was measured to range from 4 to 6 hours in patients with RA, and no unexpected accumulation was observed after daily doses for up to 24 weeks. In animal studies, Kineret has been shown to cross the blood-brain barrier, though this has not yet been studied in humans.
Indications. Kineret anakinra is an interleukin-1 receptor antagonist indicated for rheumatoid arthritis (RA), reduction in signs and symptoms and slowing the progression of structural damage in moderately to severely active rheumatoid arthritis in patients 18 years of age or older who have failed one or more disease-modifying antirheumatic drugs. DMARDs. Kineret can be used alone or in combination with DMARDs other than tumor necrosis factor, TNF blocking agents. Cryopyrin-Associated periodic syndromes (CAPS), treatment of neonatal-onset multisystem inflammatory disease (NOMID). Deficiency of interleukin-1 receptor antagonist (DIRA), treatment of deficiency of interleukin-1 receptor antagonist (DIRA). Contraindication. Kineret is contraindicated in patients with known hypersensitivity to E. coli-derived proteins, Kineret, or to any components of the product. Important safety information. Serious infections. Kineret has been associated with an increased incidence of serious infections in clinical trials in RA. In RA, discontinue use if serious infection develops. In NOMID or DIRA patients, the risk of disease flare when discontinuing Kineret treatment should be weighed against the potential risk of continued treatment. Do not initiate Kineret in patients with active infections. IL-1 blocking drugs such as Kineret may increase the risk of tuberculosis, TB, or other opportunistic infections. Use in combination with tumor necrosis factor (TNF) blocking agents is not recommended due to potential for increased rate of serious infections. Hypersensitivity reactions, including anaphylactic reactions and angioedema, and serious cutaneous reactions including drug reaction with eosinophilia and systemic symptoms, DRESS, have been reported. Patients with DIRA may have an increased risk of allergic reactions. For severe hypersensitivity or allergic reactions, promptly discontinue Kineret and treat appropriately. Immunosuppression. The impact of treatment with Kineret on active and/or chronic infections and the development of malignancies is not known. Amyloidosis. There have been post-marketing reports of injection site amyloid deposits, and in some cases systemic IL-1RAP, IL-1 receptor antagonist protein amyloidosis. Recommend patients to rotate their injection sites. Monitor proteinuria for systemic amyloidosis in patients with confirmed injection site amyloid deposits. Immunizations. Live vaccine should not be given concurrently with Kineret. Decreases in neutrophil counts may occur with Kineret treatment. Assess neutrophil counts prior to initiating Kineret treatment and while receiving Kineret monthly for 3 months and thereafter quarterly for a period up to 1 year. Serious adverse reactions. RA. The most serious adverse reactions were serious infections and neutropenia, particularly when used in combination with TNF blocking agents, NOMID and DIRA. The most serious adverse events were infections. Most common adverse reactions. RA. The most common adverse reactions greater than or equal to 5% are injection site reaction, worsening of rheumatoid arthritis, upper respiratory tract infection, headache, nausea, diarrhea, sinusitis, arthralgia, flu-like symptoms, and abdominal pain. NOMID. The most common AEs during the first 6 months of treatment greater than 10% are injection site reaction, headache, vomiting, arthralgia, pyrexia, and nasopharyngitis. DIRA. The most common AEs are upper respiratory tract infections, rash, pyrexia, influenza-like illness, and gastroenteritis. Post-marketing experience. Hepatobiliary disorders, elevations of transaminases, non-infectious hepatitis, thrombocytopenia, including severe thrombocytopenia, and DRESS have been identified during post-approval use of Kineret. Because these reactions are reported voluntarily from a population of uncertain size, it is not always possible to reliably estimate their frequency or establish a causal relationship to drug exposure. These are not all the possible risks associated with Kineret. Please see full prescribing information for Kineret at https://www.kineretrx.com/HCP/. To report suspected adverse reactions, contact SOBI North America at 1-866-773-5274 or FDA at 1-800-FDA-1088.